Before we begin, this video is general health education, not personal medical advice. Have you ever noticed that your skin feels temperature differently now than when you were younger? That's not just a feeling. It's a real change that happens as we age. This video explores why our ability to sense heat and cold shifts over time. But remember, this isn't medical advice. For personalized health guidance, always consult a healthcare professional. Your skin has thermoreceptors, tiny sensors that detect heat and cold. They send signals to your brain via nerves, creating the hot or cold feeling you experience. These receptors are found in different skin layers. Deeper ones sense your body's core temperature, while surface ones react to external changes, like a breeze. As you age, these sensors may become less sensitive, which can affect how you perceive extreme temperatures. This is why older adults might feel less comfortable in very hot or cold environments. Always consult a doctor if you notice significant changes in your skin's sensitivity. Your skin has thermoreceptors, tiny nerve endings that detect heat and cold. Deeper receptors sense your body's core temperature, while surface ones react to external changes like a breeze. As you age, these sensors may become less sensitive, altering how you perceive temperature. This can affect safety, so consult a healthcare professional if changes are significant. Your skin's ability to sense temperature isn't just about aging. It can also be affected by medicines you take. For example, over-the-counter drugs like pain relievers or antihistamines may temporarily dull your skin's sensitivity to heat or cold. Always follow label instructions and consult a pharmacist if you're unsure how a medicine might affect you. If you notice significant changes in temperature perception that impact safety or comfort, check with a doctor. As we age, our skin's ability to sense temperature can change. This happens because nerves that detect heat or cold may become less sensitive over time, often due to natural shifts in blood flow or nerve function. Some over-the-counter medicines like pain relievers or antihistamines can also temporarily dull this sensitivity. While these changes are usually normal, they might make it harder to notice extreme temperatures, which could affect safety. Always follow medicine instructions and talk to a doctor if you experience significant changes that impact your comfort or well-being. Ever wonder if your skin's temperature sensitivity changes with age, or if myths like ignoring pain or using apps can alter it? Research shows mindful attention can affect perception, but only for chronic low back pain, not temperature. Aging and medicines are the main factors. Always consult a doctor if your skin's reactions feel unusual. Your safety matters. If your skin feels less sensitive to temperature as you age, there are ways to adapt safely. First, check with the doctor if changes affect your comfort or safety, like not noticing extreme heat or cold. They can review any medicines you take, like over-the-counter pain relievers or antihistamines, which may temporarily dull sensitivity. Age 2, Age 3. Always follow label instructions and ask questions if unsure. For daily care, wear layered clothing to adjust to temperature changes gradually. Avoid relying on mental tricks like ignoring sensations to compensate for reduced sensitivity. As evidence shows, these don't reliably alter how your skin perceives heat or cold. If your skin's temperature sensitivity feels off, like not noticing extreme heat or cold, it's time to check with a doctor. They can review any medicines you take, like over-the-counter pain relievers or antihistamines, which may temporarily dull sensitivity. Age 2, Age 3. Always follow label instructions and ask questions if unsure. For daily care, wear layered clothing to adjust to temperature changes gradually. Avoid relying on mental tricks like ignoring sensations to compensate for reduced sensitivity. As evidence shows, these don't reliably alter how your skin perceives heat or cold. Your lifestyle and environment can influence how your skin senses temperature. For example, wearing layered clothing helps you adjust gradually to changes, avoiding sudden exposure that might overwhelm your nerves. Certain medicines, like over-the-counter pain relievers or antihistamines, may temporarily dull sensitivity. Age 2, Age 3. Always follow label instructions and consult a doctor if unsure. If your skin's sensitivity feels off, like not noticing extreme heat or cold, it's worth discussing with a healthcare provider to rule out other factors. When you're stressed or anxious, your brain may focus less on physical sensations like temperature, almost as if it's distracting itself to cope. Studies show people with chronic pain often ignore discomfort, but mindful attention to these sensations can sometimes make them feel more noticeable without changing the actual perception. This doesn't mean your skin is lying, just that your brain's focus shifts under stress. If you notice big changes in how your skin feels temperature, it's worth checking in with a doctor. It could be normal aging or something else to explore. Science still has gaps in understanding how aging affects skin temperature sensitivity. Some studies suggest that while certain medicines like pain relievers can temporarily dull your skin's ability to sense heat or cold, we don't yet know exactly how long these effects last or if they vary by person. Similarly, stress might make you less aware of temperature changes, but it's unclear whether this is purely a mental distraction or involves deeper neurological shifts. If your sensitivity feels off, consulting a doctor, H1, can help rule out other factors like nerve damage or circulation issues, but research here is still evolving. As you age, your skin's ability to sense temperature can change, sometimes due to normal aging, other times linked to factors like stress or medications. While science is still exploring these connections, paying attention to how your skin feels is important. If you notice significant changes, it's wise to discuss them with a doctor, H1. They can help rule out underlying issues while acknowledging that research in this area is still evolving. Always communicate openly with your healthcare provider about any concerns, ensuring they have the full picture to support you. This video is for education, not medical advice. If you notice sudden numbness or extreme reactions to heat, cold, see a doctor. They'll check for nerve damage, like from diabetes or circulation issues. Bring your symptom notes, medications, and allergies. It helps them diagnose faster. Good communication is key to staying healthy. Remember, this is general health education, not personal medical advice. For individual